federal government has intensified surveillance at Nigeria's major international airports to prevent the outbreak of human metapneumovirus (HMPV) recently detected in China. Health Minister Mohammed Ali Pate directed port health officers to screen arriving passengers for symptoms of the virus. Screening has already begun at the Muritala Mohammed International Airport, Lagos, and the Nnamdi Azikiwe International Airport, Abuja. A source at the MMIA confirmed Port Health Service has been mandated to screen passengers. We are not taking any chances. However, the Nigerian Civil Aviation Authority, NCAA, has not issued a circular to airlines on implementing additional passenger checks. HMPV is a respiratory virus causing mild cold-like symptoms or severe respiratory infections, especially in young children, older adults, and individuals with weakened immune systems. Symptoms include cough, fever, nasal congestion, shortness of breath, and wheezing. The incubation period is 3 to 5 days, and infections typically resolve within 2 to 5 days with supportive care. Global concern continues to grow as HMPV spreads to countries like India, Hong Kong, Malaysia, and Kazakhstan. In the United Kingdom, over 5,000 people have been hospitalized due to the virus. Recent reports from the UK Health Security Agency indicate rising infection rates, particularly among children under 5. The surge in the cases has been attributed to colder weather and increased indoor activity, which facilitate the spread of respiratory viruses. The Nigerian Center for Disease Control and Prevention, NCDC, assured the public it is monitoring developments globally in collaboration with the Ministry of Health and Social Welfare. Director General Dr. Jide Idris refuted rumors that the World Health Organization declared HMPV a public health emergency of international concern. He added, our goal is to provide timely, accurate information and guidance to keep Nigerians informed and prepared. You remember coronavirus, the era that had everybody rocked over. What are your thoughts on this story?
It said that the last virus that we got in Nigeria, the first known record of this virus was from an Italian man who flew in.
Yes.
So I like that measures are being put in place already. Right. Even though we haven't gotten any cases, I like that the measures are being put in place for international flight travelers. But I don't think we're ready for another pandemic, really. I haven't fully recovered from the last one. Personally, for myself, I haven't fully recovered. So I don't think we're ready as a nation. With the current status that we have, financially, we're just not ready. So I'm hoping that everything is being worked on. Honestly, another pandemic is not something that I can do.
Now, the government is doing their part by saying they are doing these checks, right? You know that this is holiday period. It's just past holiday period. Many people have left town. The UK is currently recording. Many people moved to, countries abroad. Some people are just getting back, right? What measures do you think the situation of this virus is amplified enough? For people to, I remember during the time of coronavirus, everybody started washing hands 100 times. Do you think if those measures are amplified now, it will help prevent cases where it's going to come in, if at all? I
don't think so. The earlier, the better. I think we should go back to, let's not wait, because sometimes we like to wait until it's really bad, until we're seeing it happening beside us before we take precaution. So I think it's actually right that we start now. Wash your hands. If you think you have a flu, quarantine yourself. Avoid people, or wear your nose masks and everything. If you know somebody who does have one, or a family member who does have one, keep a safe distance. So let's just start there. It might be nothing, but it's better that it's nothing than it's anything.
Right.
So I think we should start these measures
in place.